Hello and welcome. My name is Rick. This is the Bactrian. This starts my next series on motorcycling and first aid. And this series will be all about the acronym S.A.F.E, S-A-F-E. And S.A.F.E stands for survey. The A stands for assessment. And it will include the ABCs, airway, breathing, and circulation. The F stands for first aid, administer first aid as needed. And finally, the E stands for evaluation. As always, this information is in no way meant to be a substitute for professional medical evaluation and treatment. I would strongly suggest taking an EMT course and becoming trained in CPR to deliver the best care in the field. May God speak to you through these videos and grant you safety and enjoyment through all your adventures. Okay. S, survey the scene, survey the victim, get closer to the victim, are they breathing? A, assessment. So a little bit about assessment. I do nursing assessments all the time. I'm walking in the grocery store, I see somebody, I'm like, oh, I might have to do CPR on that person. They have their cart, they have, they're leaned over, maybe they have oxygen, an oxygen concentrator in their cart, and they have the nasal cannula on and they're still breathing hard. They have supplemental oxygen, they're still breathing hard, and they're kind of shuffling along. I might have to do CPR on that person. It's possible. I'm gonna kind of keep my eye out a little bit. I know a lot of people that do things like that, but we're in the medical field. So we all do assessments to some degree. It might not be a professional nursing assessment, it might not be a medical assessment on any level, but if you see somebody laying in the road, you think, are they sleeping? Are they drunk? Are they just being silly? Or are they injured somehow? If you see a ladder laying next to them, maybe they fell off the ladder, you know? And then you start building that scenario. That critical thinking starts working down and being like, let's recreate what happened here. Why is this person laying on the ground? We all do these assessments, and that's all I'm suggesting. I'm not saying that this is going to be perfect, and I'm not telling anybody to do something beyond what their abilities are. But I'm telling you to use your common sense and to use critical thinking to keep yourself safe and to assist a victim. The ABCs is airway, breathing, circulation, okay? This is the whole airway. This is where it starts, the nose and the mouth. Is that open? If it's closed, if their face is in the water, if they're face down, if they're in a fetal position, if there's a motorcycle laying on top of them, something to that effect, that's inhibiting the airway, okay? Nose, mouth, trachea, bronchus, lungs. If that airway is inhibited, they cannot breathe. And so we need to open the airway. We're watching for cervical injury. The only time we move them is if they're not breathing or if staying in that spot is going to be unsafe. There's semis coming, there's more rocks falling down the mountain, whatever the case may be. So we need to make sure that airway is open while protecting the spine as much as humanly possible. Log rolling, not jerking helmets, things like that. After we've opened the airway, then we can do look, listen, and feel again. We look down the chest. Do we see the chest rising and falling? We have their mouth right here. Can we hear breathing, and can we feel it on our ear as we look down the body at the chest to see what's rising and falling? Circulation, it's airway, breathing, circulation. We think about where the injury is. If they're unconscious, we don't know where the injury is. Even if they're conscious, we don't know 100%. But that's why we start with the carotid pulse. We start with the carotid pulse because we're not conscious. That's our probable level of injury is in the head. So we get a pulse that's close to the head. If I had an arm injury, I would look at a radial pulse because that's near the level of the injury, right? There are pulses in the feet, in the knees, in the groin. You have femoral pulses. Hard to feel unless someone's laying down. But if I had a leg injury, I would be assessing different pulses than the carotid. But if somebody is unconscious, I want to know if they're getting circulation to their head. This is really close to the heart as well. I can tell if all that's working and how well it's working. S.A.F.E, survey, assess, first aid, evaluate. A, B, C, airway, breathing, circulation. These are things that make it easy when you're not in your prefrontal cortex, when you're stressed out and you're more in your midbrain. You can't really think clearly. You can remember S.A.F.E and airway, breathing, circulation, A, B, C. We assess the look. That's not true at all.